Hey everyone, I'm Dr. Allan Acton, owner and founder of Cary Family Dental in Cary, North Carolina. Research has shown that about 70% of the teeth lost in this country are lost because of periodontal disease. Today, we're going to talk about how to protect your teeth from periodontal disease, how to recognize it, and what can be done to treat it. We'll also touch on a few ways to replace teeth that have already been lost, whether from gum disease or from decay. I'm very excited to welcome Dr. Stephen Van Scoyoc to the podcast. I've known Dr. V, as we call him, for almost 20 years. He's a periodontist based in Pinehurst, and for the past 2 decades, he has come to our office 1 to 3 days a month to help care for our patients. Dr. Van Scoyoc has completed both dental school and his residency in periodontics at UNC Chapel Hill. He has served as the president of the North Carolina Society of Periodontists and the past president of the Southern Academy of Periodontology. He leads a study club where he teaches other dentists, and now he serves as the clinical director for more than 24 periodontists in a group practice located throughout the Southeast. Stephen, welcome. And before we start talking about periodontal disease, I'd love for people to hear a little bit about your story. How did you decide to go to dental school, and what led you to become a periodontist?
Yeah, absolutely. Alan, thanks for having me. Yeah, this is a great opportunity to sit and chat with you. We've been able to work together for a long time. And to be able to do this is really exciting. So yeah, periodontics, it's I've been doing it for the past 17 plus years, practicing predominantly down here in Southern Pines, North Carolina. Um, but my interest in perio started really early on with my interest in dentistry. I was looking at what careers I might possibly want to consider, was shadowing different dentists, different specialists. And I went into the office of this periodontist, first periodontal office I'd ever been in, probably the first time I'd ever even heard of periodontics. And I was in there and I'd watched some surgeries and things like that. But then the clinician there back in Indiana where I grew up, he sat down, did this examination on this woman, this probably 35-year-old African American, slightly overweight woman. And he does this exam, makes these measurements, calls out all these numbers, looking at her periodontal health, sits her up and says, have you ever been evaluated for diabetes? And in my young college, no medical background, mind, I was blown away. I'm like, how did this guy just do a 10-minute exam on this woman and look in her mouth and ask her if she has diabetes? I would later, go on to learn in dental school and in residency as a periodontist, the incredible link between oral inflammation and systemic inflammation and chronic disease. But that was really what hooked me in the beginning, was this relationship between periodontal health and overall health. And I've just continued to be enamored by that. And the research has just grown and grown and grown over the years to, from when I first learned about it until today. There's just this wide body of literature and research, a lot of it being done at Chapel Hill, about this link. So that was the hook.
That's it's neat, right? And so, I mean, one of the things that we like about dentistry is how it's not just about the teeth; it's really about the rest of the body and how that impacts everything. I mean, I got a ton of stories of my own about how we might see something in the mouth and how it relates to the rest of the body. But let's talk. Let's back up just for a second. Let's talk about what is what is the study of periodontal, like periodontology, right? And so, like, what are we talking about? Sometimes I'll have somebody come in and be like, I need to go see a specialist, but I can't remember. Is it a periodontics or an endodontist or right? So I think sometimes the words get lost with people. So let's make sure we're all starting from the same place. When you think about periodontology, how would you describe it to a layperson?
Yeah, absolutely. No, I get that question all the time. I tell someone I'm periodontists, like, oh, so you do root canals? No, no, that's
Yeah.
not. Oh, do you do
Yeah.
braces? No, no, that's not it. Yeah, periodontics is really when we're looking at the structures that support the teeth. So the gum and the bone are what the teeth are anchored into. And periodontics really revolves around how healthy are the gum and the bone that support the teeth. Our teeth, they're not just fused into the bone. They sit there and there's this little ligament around them that attaches them to the bone. And so there's an opportunity for, bacteria to get in there and to break down the health of the bone and the health of the gum tissue. And so, as a periodontist, our job one is to identify when that process is happening, hopefully very early on, because when it's early on, there's things we can do about it. But even if it's in later stages, to understand what is the severity of that breakdown of that attachment that's supposed to be holding and supporting the teeth in place. And that process happens through a process of inflammation. And all the common signs we think of inflammation anywhere else in our body, redness and bleeding and things like that. And so those signs are indicators that there's a breakdown of that gum and bone.
Yeah, that's neat. So, like, when patients come to me, one of the first things I ask them is, "What is your goal? Right? Are you looking for something to keep your teeth long term? Are you looking for longevity, or is there something about the appearance of your teeth that you want to change? Right? Because as a general dentist, that's two of the main things that we focus on. And when we're talking about longevity, I say, all right, we're talking really about below the gums we're trying to protect or above the gums. And so with periodontology, I think you're pretty much talking about everything below the gums and how that relates to helping you keep the teeth. So people are like, I want to keep my teeth long term. Really, you need to keep the foundation of the teeth healthy. And one of the things that you mentioned about, like, how do you tell if it's not healthy is you're looking for inflammation. And when we talked about inflammation, really it goes back to that first story you told about the woman that you saw when you were observing the other dentist. Is like, it's not just inflammation in the mouth that can cause problems, it can be relative to other things. So there's a lot of research about how periodontal disease can affect the rest of your body or how they're correlated. How can people think about the other impacts about the rest of their body and the impact that periodontal disease can have on the rest of the body, or that other inflammation the rest of the body could be having in their mouth?
Yeah, absolutely. I'll start with the direction of how does periodontal disease impact the rest of the body. So when periodontal disease happens, it's because bacteria is getting into the gum tissue and into the bloodstream. So we all have a bunch of bacteria in our mouth. That's normal, but there's certain types of bacteria that are a little bit worse than other bacteria. And so if you've got a bunch of those bacteria in your mouth that are causing this inflammation, they can actually burrow into the tissue, and then that circulates through the bloodstream. And so there's all these studies that show that bacteria that should only exist in the mouth have settled out in the arteries of the heart. They've settled in the brain. And so that's why we see this link between periodontal disease and cardiovascular disease, or periodontal disease and dementia. And periodontal disease and diabetes, because that bacteria is creating inflammation in the body. And so we all have a certain level of inflammation in our body. And when there's active periodontal disease, those overall levels of inflammation increase. And so we can see that through blood tests and things like that. So you may go to a physician and they're like, gosh, you've got a lot of signs of inflammation. There's high C-reactive protein, whatever tests they do. And sometimes they're not thinking about the fact that the source of that inflammation could be coming from the mouth. So that's really how periodontal disease impacts inflammation in the body. The reverse of that is when there's inflammation in the body, or there's immune compromise in the body, when your body can normally handle a lot of the bacteria in the mouth. But if you have inflammation in the body, you have immune compromise in the body, your immune system just can't really control the bacteria in the mouth. And so inflammation in the rest of the body can impact your ability to keep your gums healthy.
Okay. So would that be, back to the original story, like the woman with diabetes, is that
Yeah.
how that relates?
Yeah, diabetes is one of the strongest correlations with periodontal disease. So if people have difficulty controlling their blood sugar, their A1Cs are high, their daily blood sugar is high, that impacts your immune system's ability to control the bad bacteria in the mouth. And so the bad bugs start to proliferate, the bad bugs grow, and your body can't keep it under control, and that causes the bone and gums to break down.
One of the questions that I get regularly, and I'm interested to see if you get this question too. One of the questions I get is, I don't think I have periodontal disease because my teeth don't hurt. Does periodontal disease hurt?
Yeah, so I always say with periodontal disease, it's sort of the curse and the blessing of periodontal disease, right? I mean, the nice thing is it generally doesn't hurt. You can have this process going on, but the curse behind it is the process can go on for a long time. And if you're not having regular dental visits, or you're not being checked specifically for periodontal disease, it can go unnoticed. And when you start to feel the symptoms, when you start to have pain, when you notice that teeth are loose, at that point, it's pretty advanced periodontal disease. We have great methods to be able to detect periodontal disease really, really early on and prevent it from progressing. But if it's to the point where you feel pain, where your teeth are loose, where there's gaps or spaces formed between your teeth, it's gotten to those later stages. So waiting for signs and symptoms is not a great situation.
Yeah. So let's say you're watching this podcast, like, I don't know, like, maybe I have periodontal disease. I don't know. I can't tell. I really don't want to, I want to get ahead of it before anything happens. Why don't you talk a little bit about how we detect it, and how accurate that is, and what we can do, and maybe the rate of change, and some things we're looking at, and talk about that for a moment.
Yeah. So, yeah, anyone who's been to the dentist recently has probably experienced this. Certainly happens in your office because your office does a great job of screening patients. But when you come in for a normal routine dental exam, there's two main ways we detect periodontal disease. One is by taking X-rays. Routine X-rays can show if there's bone loss around teeth, and number two is by doing periodontal probing. And patients don't love this, but it's where we take a little ruler and we go around and measure between the gum and the tooth. And if you have periodontal disease or you have the beginning signs of periodontal disease, that can be uncomfortable, right? Because the gums are just a little bit tender. Think of it, you've got a little cut on your skin, you touch that cut, the tissue is tender. And the same thing happens in the mouth. When you have inflammation and we go to take those little measurements, it can be uncomfortable. If you don't have any inflammation, typically probing doesn't hurt. It's really not that uncomfortable. So that's one little sign. They go to measure and you're like, ooh, this is sore. It's an indicator you may have some beginning stages of periodontal disease or at least gingivitis. And then when we look at the x-rays, we can see, are the bone levels where they're supposed to be, or have you lost those bone levels over time? Those are the main ways we detect it. In our office, in the periodontal office, here in Southern Pines, we have more advanced methods as well. We actually use microscopy. We'll take little plaque samples and look at them under a microscope to see what kind of bacteria in there. We can take oral DNA tests where we look at saliva and send it off to a lab and have them look for the specific bacteria that can be a little bit more problematic. So there's easy ways and more advanced ways to detect it.
Yeah, and so I mean, I think big picture, right? Like big picture, you're gathering data to do a risk assessment of the amount of bone loss, if at all, and the amount of inflammation they're having around their gums, because you can use that data based on the studies, your anecdotal evidence, and then like your experience 20 years to be able to give the patient sort of a basic idea about how risky they are, right? And when I think about it, I mean, tell me how you would think through this, but I think you're kind of low, medium, or high risk just for somebody to wrap their head around it. And it's with that data collection that you can give them an idea. Is that a fair way of thinking through it?
Absolutely. And the piece we haven't touched on that's additional data, which isn't necessarily collected physically by the dentist, but through conversation, is to understand patient history, understand family history, and understand social history. So from a family history standpoint, we know that about 50% of periodontal disease is linked to genetics. So if someone can articulate, my parents lost their teeth early, ended up in dentures, or yeah, my mom or my dad has had to have, gum surgery or teeth removed, that's a pretty good indicator that there's this family history and genetic component that makes you at a higher risk for periodontal disease. And then social history as well. So certainly we know smoking has a very significant impact on periodontal health, and the risk for disease is higher. The ability to have complete resolution upon treatment is more difficult when folks are smoking as well. So being able to put those pieces of the puzzle together, understanding if you have diabetes or not, that helps us understand that risk profile as well.
Yeah, it's interesting. I'll have patients that maybe haven't been to the dentist in 10 years, and they come in, they haven't really done a great job cleaning their teeth, and then there can be no signs of any bone loss, certainly inflammation, but not necessarily bone loss, which is really what we're talking about. We're talking about periodontal disease. And then I'll have people who come every 6 months, and I've been watching them for 10 years, and then they'll have the bone loss that goes along with it. And so, like, talk a little bit about how much of this is controllable at home Like, how much can you control the amount of periodontal disease you have, and how much is it just left to chance? And how much are people just going to be like, well, that's just the way it is. My parents had it, or my grandparents had it. And along the lines of parents and grandparents, I see a lot of people say, my grandparents, they had dentures, but then I'll say, were they smokers? Right? And they were smokers, but I'm not. And so I agree with you on the smoking aspect, how much that was impactful, or can be impactful.
Yeah, absolutely. So yeah, I mean, having grandparents who lost teeth and were in dentures, is not a it's not a terminal diagnosis for your teeth. You can fight those genetics through great oral hygiene at home, through regular hygiene visits at the dental office, and treating things in the early stages. So if things get detected early, they can be treated, and we can often get that well under control. There have been studies that show if you go through periodontal treatment, your 15-year survival rate of your teeth, which is about as long as we do a study for, so it could be much longer, but at least in terms of that, your 15-year survival rate of those teeth is 85+%. So we can change the course of your periodontal health despite the genetics. But there are some people who just have to fight harder than others, and that's more diligent at home, getting their diabetes under control. If you've got this genetic predisposition and you throw smoking on that, sometimes that's a combination of things we just can't fight. But for most patients, we can fight the disease if you're committed.
Tell me a story. Let's put this like a personal touch, right? Let's wrap this around somebody that maybe is a real person that you can think of, or maybe at least anecdotally, like somebody who's come to you, and as a specialist, as a periodontist, you tend to get people who have more severe periodontal disease, um, and somebody that maybe you've taken from an unhealthy state to a stable state, and what that's done for them, and how they felt about themselves, and like maybe what you helped them avert down the road that helped them meet their goals of their teeth.
Yeah, absolutely. I mean, one patient I can think of just even recently, she's probably in her 30s, had really not had, really didn't have dental care for the last, 10 plus years due to a lot of personal circumstances. And when she came in, she was fighting dental disease on both fronts, right? She has periodontal disease and she had a lot of cavities as well. She had changed a lot of her habits. She was ready to take care of herself, ready to really, make a difference. Of course, for her as a young female, nice big smile, but a lot of decay. She wanted the black spots gone. She wanted, white, beautiful teeth. But the foundation was at risk as well. And so for her, we were able to put her through, periodontal treatment. And within, 2 to 4 weeks, you automatically see this drastic change in the health of the gum tissue. But she needed that periodontal care in order to be eligible to do the aesthetic things that she wanted, and in order to help save teeth that were potentially going to be lost due to decay.
And were you able to save some teeth that you think long term would have been lost if she hadn't
Oh
gotten
yeah.
this under? Yeah, right.
For
And I
sure,
mean,
for sure. I mean,
yeah.
she actually ended up going through a full mouth rehab, having crowns on all her teeth after we got through the periodontal disease, and she looks great. And she comes in for her regular hygiene visits, and is doing really well.
And then so just extrapolate like her twin who had the exact same situation, who didn't go through periodontal treatment, like timelines maybe, or just like what you would expect for her 10 years down the road.
Yeah, so I would say someone who is at the level of disease that she was at, you know, probably at risk of maybe losing a tooth every 1 to 2 years, right? So it's not like typically your teeth are just falling out,
Yeah.
or they have to be, removed, but probably losing a tooth every 1 to 2 years. Eventually, what happens if you're losing back teeth is that puts a lot of pressure on the front teeth, that they were never intended to take, and so then those teeth start to flare, or they start to spread apart, and so you get spaces between the teeth. Teeth start to loosen, and that twin really would not be eligible for treating a lot of those cavities and having crowns when the foundation wasn't healthy. So there's a really good chance that because the periodontal disease wasn't treated, the cavities wouldn't be treated, and ultimately many of those teeth would need to be removed, not because of periodontal disease, but because of decay. And so that patient, she was headed towards dentures because of both the periodontal breakdown and the cavities.
Yeah. And, I mean, I think, and you probably feel this way. And I mean, right now we're talking a lot about didactic stuff and like how to treat people, but how does that make you feel like as a clinician and like, can you think back to like what it was to go to dental school and go to graduate school and to think, I'm going to be able to treat people. And now I can take this person who was probably destined for dentures. And while that's a reasonable solution for a lot of people, it's, we try to stay away from that if possible. Imagine how does that make you feel when you're able to take that person and keep them healthy and keep them, having that smile that she always imagined that she would have.
Yeah, I mean that you've experienced it. That's the reward of this career is the ability to have an impact on people that truly can change their lives. It changes their confidence, it changes their outlook. I mean, I've had patients who, after you take care of their periodontal disease, they go on to lose 20, 30 pounds to get back in shape, not because we fixed their teeth, but because it changed their outlook on what they thought was possible. They started feeling better. They started having some confidence in their smile and how they looked, and they wanted to continue to improve themselves individually. Sometimes it's a motivator, and so yeah, I think you've experienced it. It's a privilege to be able to be a part of that for folks who are ready and able to do it.
Yeah, I mean, and privilege is a great word. I mean, I think to be able to come to work and take some. I mean, sometimes it's just people that we just met, like a few weeks ago or a couple months ago, and then we can take them and we can talk to them about what's important for them, and they're like, I don't smile in pictures, or I feel self-conscious being around other people, and I don't, and I don't express myself the way that I want. And to be able to take somebody like that, get them healthy again, and then see them smile and excited, like it's a really neat thing to be able to do. And I'm happy to be in a profession that lets us do that. I think there are a lot of professions that you can't see that immediate impact on other people's lives, and for me that just it means a lot.
Absolutely.
Yeah. All right, so let's switch gears for a second. Let's talk about, let's say that now you have a patient that has lost a tooth, right? And there's a number of reasons why you could lose a tooth. You could lose a tooth from periodontal disease, or you could lose a tooth because the cavity got so large that they couldn't save the tooth, or the tooth cracked or broke and it wasn't fixable. And so now you have a tooth that's come out, and we know about the impacts of losing a tooth. There are three ways of replacing a missing tooth. If you lose a tooth, you can replace it with something that's removable that comes in and out of your mouth. That's we'll have to call that time a partial denture. And if you're missing all your teeth, that's called a denture. Another option would be if you lost a tooth and there's two adjacent teeth, you could have what's called a bridge, where you use the two adjacent teeth to support a 3-unit piece that fits on those two teeth and then bridges the gap where you're missing the tooth. And then what you're a specialist in is using is an implant. And if you're missing a tooth, you can have an implant placed in that missing spot if they're a candidate for it. And we can talk about why somebody might be a candidate or not. But why don't you, sort of in layman's term, talk about what an implant is and what that means, and then of course the part that goes on top of it.
Sure. So, if you think of your teeth, which most people don't think about their teeth, but if you think about your teeth, there's really two parts to the tooth. There's the crown, which is the part that you see, and there's the root, which is the part that's up in the gum and the bone that anchors that tooth in place. When you lose a tooth, the whole thing comes out, and you now have to replace both of those things. You need to replace the root part, and you need to replace the crown part. We don't have really a one-step solution that replaces both of those things at the same time. Dental implants are, really the most stable thing that we can replace a tooth with, that takes into account both the root and the crown. So what an implant is in I guess from a description standpoint, is it's a root replacement. It's this little titanium post or little titanium screw that goes where the root of the tooth used to be. It's anchored into the bone, and then that has to heal and it has to bind to the bone. And then once that's anchored and in place, then Dr. Acton or the other docs there at Carey Family Dental, they can make the tooth, the part that you really want, the part that you see, and that attaches to the dental implant or that little titanium post.
Yeah, so it's a kind of a two-part process. So um, maybe let's walk through if you lose a tooth, let's say you have to have a tooth taken out, and then till the time you get another tooth on top of that, it's really a three-part process. Fair?
Yeah, absolutely. Tooth comes out, and typically when that tooth comes out, we need to prepare the bone to be able to receive the implant. So tooth comes out, you can imagine there's a little hole in the bone where the tooth came out, and we put some bone graft particles in there, and that helps turn that hole into solid bone. We can come back about 3 months later and place a dental implant on the little titanium screw that sits even with the gum tissue. There's really nothing sticking up typically at that point. If it's in an aesthetic area, we can temporize it so it doesn't look like you have a space or a gap. We have to let that implant bind to the bone, and so it binds to the bone over about another 3 month process. And then Dr. Acton goes ahead and puts a final tooth on there. So that process is maybe 6 or 7 months. There are situations where we can accelerate that process. There are many times where we can take out the tooth and put that little titanium post in the same day we take out the tooth. And that shaves about 3 months off of the whole process. So if you need to replace a tooth, it can be anywhere from a 4 to 7 month process for an individual tooth.
Okay. Yeah. And all right. So talk about how predictable, like, is how, people say, well, how long is this going to last? Right. So if somebody asks you, how long is this implant going to last? What would you say?
Yeah. So implants are generally very successful. Most of the studies show us, 97, 98% successful.
Over
But
what? Over 10 years? Over 2 months? Like, what is that?
yeah, I mean, most of our studies go 10 years, 15 years. And so we're looking you can generally think of it as a good long-term result. Can you have a complication with an implant? Absolutely. Just like a natural tooth. It can get an infection, can't get a cavity, but it can get a gum infection. So you can develop a problem with an implant like a natural tooth, but there's things we can teach you on how to try to prevent those problems. Um, but yeah, generally implants have a very, good long-term success rate. I've seen plenty of patients who have had implants, in their mouth and healthy for 20 plus years. But there's some really important things that help determine how healthy that implant will be. Number one is the amount of bone that's there, right? When we go to put that implant in, do we have adequate bone to support that implant? And a lot of that ties back to what you were talking about in the beginning, Allan, about kind of treating periodontal disease early and making sure we identify problems. If there's a lot of bone loss due to periodontal disease and we don't have a lot of bone to anchor that implant in, the long-term success of that implant can be a little bit more challenging. The other thing that plays into that is the health of the gum tissue around it. Some people have really thick, strong gum, and other people have kind of this real thin paper thin, tissue paper thin gum tissue. And so when we place an implant, we look at, number one, do you have adequate bone to anchor the implant? And then do you have adequate soft tissue to protect that implant over time? Because you can put an implant in, two surgeons can, or general dentists can put an implant in, and that implant can be healthy day one. Everything looks great on year one. Everything looks great on year two. Things look pretty good on year 3 or 4. And by year 5, as an example, you're starting to get inflammation. You're starting to get breakdown of the tissue. And a lot of that depends on, was there adequate bone? And was the soft tissue considered when the implant was placed? Was there enough soft tissue to protect that implant over time?
Yeah, it's interesting. And, I'll be dealing with a family member who needs two implants coming up. So my daughter happens to be congenitally missing her laterals, her front upper lateral teeth, which are the two next to your two front teeth. And so like, it's not just about replacing back teeth. You can also replace the front teeth too. And it's nice to have a surgeon involved in that because it can be a little bit more complex with the aesthetic zone that's there.
Yeah, and that I will say is one of the really fun things about being a periodontist, is that we place implants, we deal with soft tissue on a daily basis, so that's really in our wheelhouse. So when we start thinking about the aesthetics of implants, you know, periodontists kind of nerd out and get kind of excited because not only are we doing the surgery to get the implants in place, but we're trying to really use our skills of artistry to figure out how to get that gum tissue to look as natural as possible. Because when you're congenitally missing a tooth that was never there to begin with, oftentimes you have to recreate those structures that never formed naturally. So it's not about just getting an implant in. It's how do we shape and sculpt that gum tissue so that when she smiles and she has a photograph taken, you really can't tell that those lateral teeth are implants. They look as natural as possible.
Yeah, I memean, the skill set that you're bringing to the table as a periodontist, I mean, you're part engineer, you're part architect, part as you know, artist, and part medical doctor, all kind of combined into one thing, and I think that's not to be underestimated. What do you think is your favorite, your funnest part of your job? What when you get excited about coming to work, and you're like, "This is going to be a great day," and or you come home and you're like, "I just had the best day." What kind of things get you excited about coming to work each day?
Yeah, I mean, I'm going to answer the question honestly. I don't know if it's going to be the thing that your patients and folks watching this would be most excited about. But I really, really, really love soft tissue grafting.
Okay.
So we haven't really touched on this. It's a little bit outside of uh, active, infection, periodontal disease, or out of the realm of implants. But a lot of patients in your practice and all across the country experience this, where the gums are starting to recede and they're starting to see dark lines where the roots are exposed of teeth. And a lot of that's genetics. Some of it's due to orthodontics, as teeth have to be moved to expand and make room. The bone and the tissue can thin out. And so when the roots of the teeth start to get exposed, oftentimes it's an aesthetic concern for patients. So when I have the ability to go in and do a gum graft surgery to not only raise that level of tissue or lower that level of tissue to cover those exposed roots and get a really nice aesthetic result for the patient. I also know as the clinician that the aesthetics for me are the side benefit. What we're really getting to do is go in there and protect the tissue and the bone from a health standpoint. So that's something I really enjoy.
Yeah, so let's dig into that a little bit. Like, why do you enjoy that so much? Like, when it's successful, why was that? Like, it's not just about like having a great clinical result. Like, what is it that you're feeling when you do that?
I think why it's so enjoyable is probably some of the things you get to experience in general dentistry on a regular basis, which is the fact that patients see the impact right away. The patient can lean back in your chair, you do a beautiful crown or restoration on the patient, you sit them up and they look and they go, "Oh my gosh, my smile's back." And that happened in the, 30, 45, 1 hour time frame that they were in your office. For me, a lot of the things we do with periodontics, like placing the implant, like I said in the beginning, nobody wants the implant. They want the crown that you put on the implant. And when you're treating periodontal disease, yeah, they're happy we saved their teeth, but it doesn't always necessarily look a whole lot better. It just is healthier. With the soft tissue grafting, we can do the graft, raise the tissue, and yeah, there's sutures and stuff in there. But when they go home that night, or when you sit them up in the chair, there's a visual transformation that they get to experience, and so that's fun, right? It's fun to have your patients happy and thankful for the work that you've done. In addition to that, it's really technical. It's the soft tissue grafting takes a lot of skill, and certainly better at it now, 17, 18 years into it than I was right out of residency. So I feel like that's a skill that I've been able to develop. And one of the things that we're able to give patients at your practice and in the practice here in Southern Pines as well is we do a lot of grafting with the material called alloderm. Alloderm's a donor tissue. So rather than having to harvest tissue from the roof of the mouth or something like that, we have this tissue that we can use, and we get really good results with it. Um, there's a lot of folks who maybe shy away from that material because it is very, very technique sensitive. And so you have to be really comfortable with it. And we've been doing it so long that we're really comfortable with it and we can get good results with it. But when I have a patient come in who's maybe had a graft before and they've experienced some of the pain of having to have tissue from the roof of the mouth, and I can offer this to them, and they can come in and anywhere from 30 to 40 minutes, we can correct the problem. They go home with with minimal discomfort, a few sutures in place, and that's a very different experience than maybe what they experienced before or what they remember their parent or grandparent describing about the gum grafting that they had had. That's rewarding to know that we can get them we can help them to a good result, but also do it in a much less invasive way.
Yeah, and it's really neat, right? And and it comes back to what we talked about before. It's really about the people and how we can serve them better in our profession. And I think as you and I have advanced for our career, we're finding more and more joy out of that aspect of it.
Yeah,
Um,
absolutely.
and I want to ask you about a new thing that's going on in your life that I think might also be fun for you and enjoyable. Your son is getting ready to graduate from college, and he had just gotten into dental school.
Yeah, very excited about that. Yeah, my oldest son, Carson, he's finishing up at UNC Chapel Hill, and found out recently that he'll be heading to UNC Chapel Hill for dental schools. Yeah, it's really exciting. It was one of those things where you'd ask him when he was young, you think you want to be a dentist? And, nah, I don't want to be a dentist. I don't want to be a dentist. As he got closer to college, he considered it, but I think it was sort of this, do I really want to follow in dad's footsteps or do I want to forge my own path? So he went into college in computer science and started in that realm, but ultimately decided taking care of patients was something that he was passionate about as well. And so forged his own path and was able to get to UNC Chapel Hill, and that's very exciting for all of us that he'll be staying relatively local and moving into the dental profession. So
That's great. And I know you must be proud of him, but he must
absolutely,
have looked to you as an example of somebody who loves their job and is doing good things in the world and said, "Hey, I want to follow that example." So that's really cool. And it's neat because it's kind of coming full circle because when I first met you, you were in your residency program at UNC, and now you've got somebody who's getting ready to head into their dental profession as well. So it's kind of neat.
it's true. Yeah, you met me, Carson was 2 or 3 years old, and I was in residency, and yeah, and now we're
Now look at
we're heading back to residency as a family.
that's
So
right. Yeah, that's great. Well, I know you've got a thriving practice down in Southern Pines. Is How can people find you? And anything else that you'd like to add about anything that we've talked about? Obviously, they can find you at our office, and if they happen to be down that way too, they'd be a good place to find you down there.
yeah, absolutely. So, no, I mean, I think we've covered a great range of topics, and hopefully, it's things that resonates with folks, and they can see maybe where there's areas they're just not sure about their health, whether it be periodontal health or they're missing a tooth or they're seeing gum recession. Hopefully, we've given them some information that'll help them to be able to make some decisions. But yes, of course, you can find me at Carey Family Dental. It's been a pleasure. When we first started working together, I was a resident, and so we thought, well, this will end when I finish residency. But we've kept up the friendship, and it's other than my primary office, it's the only other place I go to. I don't travel around to a bunch of offices, but it's because of the great folks there at Carey Family Dental. I've really enjoyed working with Allan and that whole team for a long time. So you can find me there. Also, my practice here in Southern Pines is you can find us where our website's periodonc.com. So real simple, periodonc.com. We're in Southern Pines, and we recently just opened an office in Sanford where my partner Dr. Connor goes. So that you can find us in that region as well.
Oh, that's great. Well, I just want to say thank you for all the care that you've given to our patients over the last 20 years and the friendship that we have. I think it's great. I like being able to share clinical stories and watching your great family grow. And it's been a lot of fun. So thank you very much for this time and for these past 20 years.
Yeah, it's been great. Thanks so much, Alan.
Yeah. All right.